Konnichiwa, ni hao, magandang araw. We are the second group who are assigned to the different beliefs and practices in Asia. But before anything else, let's get to know the group members. We have Miss Maylene Bulfa, Miss Maria Ariana Capuy, Miss Jessica Cortezo, and Miss Carina.
Practices in Asia. Let us first discuss the values that practiced in Asia. First is filial duty. In Asian families, it is a must that children give back or take care of their parents. And then family and mutual dependence is valued over independence. Also, father and sons are usually considered the head of households and decision maker. This practice is usually done in countries such as China, Korea, Vietnam, and Cambodia. Also, in Asia, the households usually consist of nuclear family, and patrilineal and extended is practice. The best example of this is children using the father's surname. Next is respect for elders and those in authority, or elder males and females are equally respected. And same as respecting elders, males and females are equally respected. As the number of females going to school increased, gender parity was reached in Central Asia and East Asia and the Pacific in 2016. Now let us move on to the food and religion. In the religion of Islam, halal food is prepared, which usually consists fish or seafoods, grains, bread products, and etc., and no intoxicants in medications or preparations. Islam religion also practices fasting for 1 month. Also, Sikh religion forbids eating the beef and pork, and Hindus and Buddhism usually only eats vegetables.
Here are some superstitious beliefs in Asia. First is the evil eye. The evil eye is a magical curse that roots back to ancient times, with fear inherited from generation to generation for centuries. It is believed that the power of the evil eye can knock down ancient antiques, strip one of his health, or even lead to death, in some cases just by inflicting a look upon an object or person with the intention of harm, suffering, or any form of bad luck. When it comes to superstitions, and the evil eye especially, Arabs take it pretty seriously. They bless their new cars or houses by sacrificing an animal to the gods and printing the Kamsa sign with their own bare, bloody hands all over their new possessions. Lay your chopsticks flat. In many parts of Asia, one of the most crucial cultural taboos is sticking your chopsticks vertically into a bowl of rice. Although it may seem convenient or even natural, the image resembles incense sticks offered to deceased family members in countries like China and Japan. Bypass photos of 3. In many Southeast Asian countries, it is believed that a person posing in between 2 friends in a photograph will be the one to pass away first. So it might be best to take photos by pair, rotation, or stick to solo selfies. Another popular belief across Asia is opening umbrellas indoors, which is tantamount to letting it rain bad luck on you and on the owner of the home or business. Next is whistling at night. It is said that whistling is a way of calling the evil spirits that are roaming around at night, waiting for their next prey. When sitting at the table for a meal and someone gets up to leave before the rest of the group finishes, everybody left at the table should turn their plates to ensure safe travels for the person living. Another belief is reassure your host that you are human. A very common line used by Filipinos when knocking on someone's door is, "Tao po." Many assume it refers to the knocker calling out to ask if there are any people inside, when actually, it is said to stem from the knocker reassuring the people inside that he or she is a person and not a possible harmful supernatural creature.
Now, let us talk about the health beliefs and practices in Asia. Though not all Asian countries were included, but some of the dominating ones were noted. First, we have the Japanese. They believe that harmony maintains health and impure elements such as corpses or skin disorders causes poor health. The main religions in Japan are Shintoism and Buddhism. Shintoism sees disease to be unclean and impure, whereas Buddhism sees it as part of life. Moreover, funerals also follows Buddhist beliefs. Additional to that, both herbal medicines and traditional Western medicines are followed in Japan. They may use acupuncture or acupressure when diseases occur. They also suppress their emotions because it may represent weakness, thus making pain assessment difficult for the healthcare workers. There are also food combinations like hot and cold or overly sugared foods that are avoided in order to avert poor health. Among the Chinese, they always have believed that yin and yang helps in maintaining health balance. Also, when there is lack of qi, illness occurs. Aloe vera and ginger tea are considered as barriers to seeking health care because they would immediately resort to this when they are sick rather than getting professional help. The same goes for Tai Chi. The Chinese believe that Tai Chi improves circulation of qi in the body and enhances a person's overall health. Many Chinese people would prefer using their traditional herbal medicines and cultural practices than seeking Western health care. They are also somehow prideful to seek health care and share their pain because it is shameful for them. And now we have the Vietnamese. They believe that to live a harmonious life, yin and yang should be balanced. In order to ward off any illnesses, they perform different rituals. Individuals are hesitant to seek health care but utilize divine instruction, astrologer, and other healers. For them, diet also plays a part in maintaining good health. For the Filipinos, according to the principle of balance, health is thought to be the result of balance, while illness is due to humoral pathology, and stress is usually the result of some imbalances. Here are some Filipino beliefs related to the concept of balance. First, the rapid shifting of temperatures are believed to cause illness. Next, warm temperature helps in maintaining good health. Cold drinks should be avoided in the morning because it may result to something called panuhot. So we also have an overheated body is vulnerable to diseases because a heated body can get shocked. When the body is cooled quickly, it can cause illnesses. A layer of fat maintains warmth, protecting the body's vital energy. Imbalance from worry and overwork creates stress and illnesses. Also, emotional restraint is a key element to restoring balance. Also, for Filipinos, a sense of balance imparts increased body awareness. So, whenever Filipinos get sick, they always resort to hilot or massage, which is done by albularyo's or manghihilot. Then also, Filipinos believe that barang or kulam may be the reason of their undiagnosed diseases.
In Asian people, due to the belief of yin and yang, they practice acupuncture, acupressure, and moxibustion to restore the balance of the body. Asian people also utilizes herbal medicines and usually consults in folk healers. In relation to the supernatural belief of Asian people, they practice supernatural treatments including reading religious texts and praying, exorcism, and attending religious events.
Application
That's
to
all.
nursing. We all know culture is a strong part of people's life. It influences our views, our values, our hopes, and our worries and fears. So when we are working with people and building relationships with them, it helps to have some perspective and understanding of their cultures. So as a nurse, it is very important to know the cultural beliefs and practices of our patients because it affects how our patient will seek care and from whom, how he or she will manage self-care, how he will make health choices, and how she might respond to a specific therapy. So diversity in nursing field is very essential because it provides opportunities to administer quality care to our patient. If we nurses who understand our patient's culture, environment, food, religious views, and etc., then we can provide to our patients an ultimate care.
Thank you so much for listening. Have a good day.